evening, everyone. Distinguished guests, dear colleagues, welcome. It's really such a privilege to welcome you all to this session of the World Health Regional Summit. Today's event comes as a part of a series being led by the Global Leaders Network for Women, Children, and Adolescents Health called Domestic Resource Mobilization in Action, which has explored innovative financing solutions to the evolving reality of shrinking fiscal space and shifting donor priorities. And today, we are turning our attention to a critical approach, debt swaps for financing women, children, and adolescents' health. And this is a rather unique event because I do have an esteemed group of panelists here in person with me in Nairobi, and we are joined also in a hybrid mode by people online and some of our panelists. Let me start by briefly introducing the panel that we have here today to reflect on these issues. A huge pleasure and privilege to have Advocate Biens Gavanas, Vice Chair of the Board, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, Namibian lawyer, Chancellor of the University of Warwick, and former Special Advisor on Africa for United Nations. Thank you so much for joining us, Biens. We will also be imminently joined by Dr. Fidel Nagabo, Head of Division, Maternal and Reproductive Health, Africa CDC. He's running a little bit late from another panel. Pleasure also to have you with us, Dr. Velasquez, Program Coordinator, Debt to Health, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, joining us virtually. We also have country representation, Guilherme Dinsa, Health Financing Senior Advisor, Ministry of Health, Ethiopia. Pleasure also to have you with us, Rose Oronje, Deputy Executive Director, Head of Program, African Institute for Development Policy. And last but certainly not the least, Senior Program Officer from Bill and Melinda Gates Foundation, Adil Ababo. Colleagues, as you can imagine, with this varied expertise that we have in the room, we are going to have a rather stunning conversation. But we are here to discuss a challenge that is as much about economics as it is about human lives. We are meeting at a moment of profound fiscal tension, where high levels of debt are no longer merely accounting figures, but a growing strain on national budgets that steadily erodes the resources available for essential services, particularly related to women, children, and adolescents' health. Today, the majority, or 58% of AU countries, spend more on external debts than they do on healthcare. This is a sad reality that must be addressed. This trend creates massive barriers towards achieving universal health coverage and meeting our goals for health and well-being of women, children, and adolescents. But colleagues, even before the current development aid cuts in 2023, more than 3 billion people were living in countries that spend more on debt interest payment than on education or health, which I'm sure you will agree is unacceptable. Debt relief is not a new concept, but it is re-emerged as a vital policy tool to alter this trajectory. And for those of you who did manage to catch the plenary yesterday, we did have the German Development the Director General and also other speakers refer back to this promising intervention repeatedly. By promoting relief, we can rapidly expand physical space, turning debt into an engine for development and how we can move together collectively. We will hear today from governments, UN agencies, health financing experts as we explore the strategies to leverage debt swaps and hear country experiences and innovations where debt swaps had been used to finance the women, children, and adolescent health agenda. With this in mind, and before we kick off, turn to the panel discussions and our framing remarks from esteemed panelists, I would first like to hear from you all. And there are several hundred people who have registered online to join this conversation, and several of whom are already connected with a Mentimeter question. In your country context, how are debt dynamics currently shaping fiscal space and investment in women, children, and adolescent health? So, colleague, use the QR code, scan it with your phones or your devices, and do share what thoughts you have in this regard. And we will keep it live for a couple of minutes while the word cloud starts to emerge, and then we will turn to the next segment. I can see lots of people getting online very quickly. So the question is, and you will have to use one word to describe in your own country context, how are debt dynamics currently shaping the fiscal space and investment on women, children, and adolescent health? Shocking. Bravo. That's the first word that do comes through. We can see the words now starting to emerge: shrinking fiscal space, not proper, crippling, indeed, negatively affecting the fiscal space, limited access, very badly. Indeed, let's give it another minute before we start moving further. Disappointing, paralyzing. Colleagues, do bear these words in your mind as we go through the next 90 minutes of this conversation, because these are the words, these are the challenges that we are looking forward to addressing and reflecting collectively on how do we address these issues, how do we make of the opportunity that this innovation, that is debt swap, provides us with. And to open this session, I would like to first introduce, as I have briefly previously, Advocate Biens Gavanas, the Vice Chair of Board for the Global Fund, for you to, ma'am, share your reflections on the event today and the intersection between debt, fiscal space, and investments in women, children, and adolescent health. Thank you so much again for joining us.
Thank you, and may I also say good morning, good afternoon, good evening. Let me start by expressing gratitude to our moderator today, the Executive Director of PMNCH, and all the panelists and all those participating in today's discussion. It is indeed a privilege to open this important conversation here at the World Health Summit, at a defining moment for the continent's health and development trajectory. Now, I'm speaking as the Vice Chair of the Global Fund, but I just want to take a very brief detour, if I may, because the discussion on maternal, child, and adolescent health takes me back to many years ago when I was the Commissioner for Social Affairs. And at the time, feeling that not much attention has been paid to maternal and child mortality. And hence we launched the campaign called Campaign for Accelerated Reduction of Maternal Mortality in Africa. So the awareness is there that was not there before, and therefore there is no excuse. But the question has always been about where do we put our resources when it really matters. So I'm glad that I put my other hat on and start talking about exactly that after I had been on this journey with many of you that were part of the campaign at the time. I think during the course of the last day or two, we have heard about the rapidly changing financing landscape, and we have not only heard about it, but we have experienced it and we have felt it in many of our organizations. I don't also need to really rehearse the fact that the first casualty when it comes to fiscal constraints are the social sector, and hence the health sector. And then you go further and you go further down the line. But we are also glad to notice that African leaders are calling for greater health sovereignty. What does that mean? It means developing programs that are nationally owned, that are fiscally sustainable and aligned with domestic priorities. And I want to underline that it should be aligned with domestic priorities, because sometimes we may feel that we know better than countries and we invest, but we invest wrongly, not investing in that which matters. The Global Fund continues to be a partner for countries on this pathway to sustainability. So You will hear a lot about domestic resource mobilization. You will hear a lot about sustainability. What does it mean for many of our countries? I have already mentioned that the changing global context is a stark reminder that domestic resource mobilization is no longer a long-term aspiration. We are not talking about 2063. We are actually saying Africa has to take ownership and fund its health priorities. Too often, debt servicing competes directly with investments in the social sector, competing with financing for primary health care, the health force, nutrition, as well as reproductive and adolescent health services. And yet we also know that investing in women, children, and adolescent health is not optional. It's a foundation of Africa's future. It is indeed the highest social and economic return. They shape intergenerational equity and long-term sustainability. When these investments are deferred, the costs are borne by health systems, societies, and economies for decades to come. This is why today's discussion is key. Debt financing on its own does not guarantee better health outcomes. What matters is how fiscal space is unlocked, how it is governed and managed, and whether it is deliberately channeled toward priority investments. Debt swaps offer one pathway to translate micro fiscal solutions into tangible health gains while reinforcing country ownership and accountability. The Global Fund has been a pioneer in this approach. We are currently the only entity that has an operational debt swap mechanism in the health sector, and my colleague will be addressing that issue later on. And through this mechanism, we have been able to support countries, including Africa, to convert sovereign debt into domestically management investments in health. Our model demonstrates that innovative financing can reinforce rather than undermine health sovereignty by aligning debt reduction with national systems, shared governance, and measurable health results. Importantly, debt swaps also require a new quality of partnership, and this includes close collaboration between ministers of finance and ministers of health, constructive engagement with global north donors and debt countries. Importantly, an active role for civil society to ensure transparency, accountability, and alignment with community needs. Let me also emphasize one important point about debt swaps. They are not a macroeconomic solution to debt burdens and should be careful not to be that we not present them as such. Their strength lies elsewhere. Even relatively modest volumes can deliver highly targeted, measurable impact, particularly in areas like women's, children's, and adolescent health, where well-directed investments translate quickly into better services, stronger systems, and safe lives. The real opportunity, therefore, is in the quality and accountability of the investment these instruments can unlock when they are aligned with national priorities and implemented through trusted systems. As Africa charts its path in an era of constrained fiscal flows and heightened fiscal pressure, we need to look at innovative financing mechanisms to unlock as much funds as possible for health. We can't afford not to have sufficient investments in health more broadly, and in particular for women, children, and adolescents' health. The Global Fund was created on the foundation that partnerships saves lives. Over 2 decades, our model has proven that when governments, civil society, the private sector, and affected communities come together, the impossible becomes possible. Together, we have saved over 70 million lives. We have strengthened health systems in more than 120 countries. Let us harness that partnership again to face today's challenges. Colleagues, friends, I'm happy to hear more from our panel about how debt solutions and health priorities can be better aligned to protect and advance the health of women, children, and adolescents. I look forward to the insights and experiences to be shared today and to a discussion grounded in partnership and a shared commitment to Africa's health sovereignty and long-term resilience. I want to end by saying I believe in global solidarity and shared responsibility. Thank you.
Thank you. Bravo. Thank you. Thank you for that powerful opening, Advocate Gavanas, and then laying it out so clearly what's at stake, how do we get there, and what are some of those non-negotiables. And to help build on that powerful framing, it is my pleasure now to introduce Velasquez Tigreques. Apologies, I'm sure I'm mispronouncing your last name. Velasquez, Program Coordinator, Debt to Health for the Global Fund, to advance this discussion. And Velasquez, looking forward to hearing from you how has Global Fund advanced this innovative financing approach for debt for health swap for many years, and how we can build on that further in other areas and contexts as well. Over to you, Velasquez.
Thank you so much. Can everybody hear me clearly?
Yes, we can.
Wonderful. Thank you so much to everyone, to all the participants, facilitator, to our board vice chair for the opening remarks. And I'm particularly happy that the person who gave birth to Debt to Health is sitting among you in physical room on the other side of this channel. And this is Dr. Christoph Ben, who in his prior capacity as head of division of external relations of the Global Fund, gave birth and came up with this idea. Second, I would like also to take up the thread of our board vice chair and continue from there. I will share my presentation, and I hope everybody can see it clearly.
Velasquez, your slides are on. You can please go ahead. And if you could switch to the slide mode, then it would enlarge the font.
So I assume that you can see my presentation.
Yes, we can. Thank you. Please go ahead.
So let me start with one key point. Debt swaps only work if there is a system that can actually translate financial flows into real, measurable health outcomes. I invite you here to think upside down. Sometimes we come up with a project and then we are trying to find debt swaps to fund the project, while the Global Fund works the other way. We have a platform that funds national health strategies, and as part of the system, every 3 years, we invite countries to tap into our allocations, the so-called allocations, and that part of the approved national health strategies costed programs that cannot be funded by those allocations are converted in what we call unfunded quality demand, which is a set of programs that should, but currently cannot be implemented, and they are approved by our technical experts as are aligned with national health strategies and technically viable. This platform aligns with
Well,
national
Aziz, I'm sorry
strategies,
to
uses
interrupt you.
existing country systems, and ensures transparency, accountability, and measurable results. The question we asked was simple. Can this platform of unfunded quality demand can also be used to convert debt into health impact? And that's exactly what Debt to Health does. The reason this works is very practical. In many financing mechanisms, the challenge is not just raising the money, it's knowing where to put it. At the Global Fund, every 3 years, we go through the same rigorous process. Countries identify their own national health priorities. They convert their national health funding strategies into costed programs. Based on that, they submit funding requests to the Global Fund. They are technically reviewed. And importantly, whatever cannot be funded from our allocations becomes unfunded high-impact demand. When national resources become available, like debt swap proceeds, we don't need to design new projects. We don't need new governance structures. What we do is simply cost efficiently scale up existing grants. So what is debt to health? In simple terms, a credit country, here is a real example of Spain, agrees to forgo part of a debt. That was a transaction done in 2017. The total amount of canceled debt was 24 million. In exchange, the debtor country, Cameroon, agreed to provide 9.3 million to scale up the Global Fund's existing HIV/AIDS grant to Cameroon. That had a very visible impact of providing an additional 30,000 HIV-positive patients to antiretroviral treatment. The key point is this: these funds are not standalone, they are fully integrated to existing grants, which means that we have no parallel systems, no duplication, no additional complexity. It's simply a mechanism that redirects financial flows into existing high-impact health investments. And this is our track record. As you can see, we have averaged about 17 million of debt swap proceeds per year since 2007, over 14 transactions. I want to be very clear of what debt swaps can and what they cannot do. They are definitely not a solution to over-indebtedness. Nobody has ever argued that 17 million can save an over-indebted country's problems. The volumes are relatively small and their macro fiscal impact is limited, but we should not overstate that. That's not where the value lies. The value of 30,000 additional lives saved from the Cameroon-Spain debt swap example that I showed you before is priceless. Even relatively small amounts can deliver very significant health impact. So while there is often a correlation between high debt burdens and constrained health spending, debt swaps are not about fixing the debt problem. They are about ensuring that when fiscal space is created, it translates into tangible investments in health. And in particular, in the context of our discussion, these are areas where targeted investments can have immediate measurable effects and where predictability and accountability really matter. So a key point from this slide is impact efficiency is the key, not macro scale debt relief. My final point is why this model has worked in practice through some key lessons learned. First of all, alignment. The funding goes directly into national priorities, no external project design. Second, the Global Fund is a platform, not a project. We use an existing multilateral system with proven capacity. The third is flexibility. Implementation is not tied to the timing of debt negotiations. Focus, it's not about debt relief, it's about maximizing health impact. And finally, additionality. The resources that are generated by debt swaps complement existing health financing. They do not replace it. So the result is a model that is operationally simple, politically acceptable, practically scalable, and importantly, it creates a direct, credible link between financial decisions and health outcomes. I leave you with this one message. Debt swaps are not a silver bullet for debt challenges, but they are a highly effective tool to convert relatively small financial adjustments into meaningful, measurable progress in health. In the context of our discussion, that means better services, stronger systems, and real impact for the health of women, children, and adolescents. The model exists, the experience is there. What matters now is whether we choose to use it and scale it. Thank you very much.
Thank you so much, Velasquez. That was brilliant, and thank you really for that comprehensive framing and insights into how debt can be converted into life-saving health investments. And I do really appreciate the point you made that there are no silver bullets, and it comes down to political will, intentionality on how we can drive this further together. We will come back to you, as you rightly said, in the panel discussion. But before we move into that segment of our conversation, it's a huge pleasure for us to have from the government of Ethiopia, Dr. Girame Dinsa, the Health Financing Senior Advisor for the MOH. And Dr. Girame, it would be very helpful for us to understand from your perspective the tremendous experiences Ethiopia has had and the leadership that you have shown in terms of the debt for health journey, including the role of different stakeholders that have been involved, and your initial reflections on how do we situate this conversation moving forward. And then, colleagues, we will come back as a panel conversation to move this discussion forward. Do keep on using the Mentimeter. There are about 200 people online and a packed room here in Nairobi. So it's clearly a conversation many want to be part of. Over to you, Giame.
Thank you. I hope I can be heard.
Very loud. Thank you.
Right. So, yeah, thank you for setting the scene for my country case study, if you like. So Ethiopia used the opportunity of this debt swap through actually the Global Fund Debt to Health program. Just to give you a little context about Ethiopia, just like many low and middle income countries, Ethiopia is also struggling with debt pressure, if you like. And as you would understand, a country that is supposed to be debt servicing would be limited in their capacity to finance social sectors, including health. Ethiopia currently has about a little over $100 billion of debt, and most of that is from external sources. And if you just to give you what that means in terms of the GDP, I think that debt to GDP ratio in Ethiopia kind of varies between 40 to 50% of GDP. And there have been efforts recently to repay the debt as quickly as possible, so this figure might be slightly lower. Ethiopia went through an economic reform in the last 1.5 and 2 years, and part of that reform included a currency depreciation, and that has also created another challenge in terms of debt servicing, because you need more of local currency to pay the same amount of dollars. And as we speak, every year Ethiopia is servicing about $3 billion per year. So that's about 15% of total government budget. So you can imagine if the country is able to spend that much money in social sectors like health, probably we wouldn't need external support or donor money. So, what is the history of Ethiopia's debt swap? So it started in 2007, actually, and this was between the the government of the Kingdom of Spain and the Ethiopian government. So the discussion was to cancel Ethiopia's close to 9 million US dollar debt in exchange for Ethiopia's agreement to spend about 3.2 million euros in pre-agreed or arranged programs. That was supposed to happen through the World Bank platform. Unfortunately, it didn't go through. Although Ethiopia had paid that amount of money, 3.2 million euros, to the Spanish government. But the project was cancelled, so the World Bank didn't implement that project. And that money had to lie in Spanish government account for 10 years before the Global Fund came into picture. And so the actual debt swap happened in 2017 after 10 years of the initial debt swap agreement and through the Global Fund platform that the previous speaker eloquently discussed. So the existence of that platform and the Global Fund initiation really helped in facilitating the debt swap deal between Ethiopia and Spain. And so the same amount of money was transferred to the Global Fund account for Ethiopia to benefit from the debt swap deal. And so, as you can imagine, it was a tripartite agreement between the government of Spain, the government of Ethiopia, and the Global Fund to implement the debt swap fund in Ethiopia. If you look at the agreement, the tripartite agreement, it doesn't say much in terms of what needs to be implemented, what would be the indicators of success, what is the reporting time, the reporting line, monitoring and evaluation system, and so on. All that was taken care of, as the previous speaker said, because the platform existed, and so there was a trust between the creditor and the debtor for the platform to implement the agreement. So I'll just quickly go into that. So the existence of the platform is a positive thing, and for this debt swap to work, that kind of platform is important. But it also has its own challenge. So because the platform exists and there is already a prioritized set of activities, if you like, or programs to be implemented, but then it would be difficult to really monitor and say, okay, this was the impact of this particular fund that is agreed through the debt swap deal. So it's part of a larger program or a priority setting. As said before, it's efficient. There is no doubt about that. You don't need to create a different or a new project. But then the impact of that particular funding is difficult to manage, and that was the case in Ethiopia. And as I said before, the previous agreement between the two governments and the World Bank didn't go through because I would imagine the platform was not strong enough at that time. So the money was lying in somewhere for 10 years before it was implemented. So as I said, lack of attribution of this particular platform was what we were able to observe in Ethiopia. And because of that, in the agreement, you don't see specific indicators and reports what's happening, particularly because the Ministry of Finance is the part of government that is dealing with the contract. And you need to have a very strong coordination mechanism within country between the Ministry of Finance and the Ministry of Health for the debt swap to work seamlessly. And that is what we had in Ethiopia. So even though the agreement didn't specify what needs to happen, when it needs to happen, who is monitoring and so on, evaluating, already the Ministry of Health had that platform which was working with the global work seamlessly. And so the Ministry of Finance didn't worry about whether this was implemented efficiently in the right way and so on. So for countries really to effectively implement debt swap, they need to have a very good coordination mechanism within their countries. So I think let me finish by saying some few recommendations for countries that would like to implement debt swap. So first of all, I think proactiveness is really important. You need to be proactive in terms of exploring what priority areas you have, what priority, say, health programs you want to fund through this program. And the national priority setting is really important. And you need to have that with your development partners and donors, like the Global Fund and other donors in place. And then it's also important to proactively explore what creditors are more likely to be open for funding, which creditors and what program areas they are interested in debt swapping. And as I said before, having a development partners that are kind of mediators, like the Global Fund did in our case, is also important, because sometimes countries they don't necessarily have the platform to negotiate with creditors. So having the development partners and donors to mediate between creditors and debtors is really important. And as I said earlier, having the national in-country a functional coordination mechanism is the key for a successful implementation of debt swapping. Let me stop there, and I'll be very happy to answer your questions if you have any. Thank you.
Thank you. Thank you so much for that, Girma. Extraordinary, really, and exemplifying how debt repayments can be transformed into sustainable health initiatives, and really applaud Ethiopia's leadership. Colleagues, we have a unique privilege of having this extraordinary group of people around us, and several of you have been already firing away questions, which we will come to, so keep on doing that. But let me now dive into the panel conversation. We are still waiting. Our colleague Fidel Nagabo from Africa CDC, I know they are held up in another meeting, so he will join us momentarily. But in that regard, let me then start with you, Velasquez. And the question that I wanted to kick off with is, what are some of the most practical entry points for countries to initiate and structure debt swap negotiations, and any practical learnings that you can share with us? Over to you.
Yes, thank you very much. I would say there are three key points that I also highlighted in my presentation. And they boil down to one thing: turn it upside down. First, do not define the project and then go about looking for debt swaps. Create a platform, whether it goes through the Global Fund or whether it goes through your own systems, even better. Your national health strategy is translated into costed interventions. The core of this strategy should be funded by core funding. Currently, it's international funding, the allocations of the Global Fund, but we all agree this will become gradually a bigger and bigger percentage domestically funded. All countries have to build higher, and that's where is this unfunded quality demand. If you have a set of experts that agrees that this is aligned with the national health strategy and is strategically important programs, then whatever cannot be funded from core funding, this should be set out as the programs that are available for any creditor who is interested in doing debt swaps. And approach creditors not with the narrative, hello, we are over indebted, and we would like to do a debt swap to address our over indebtedness. This is not right. Reach them to say, hello, we have a national health strategy. The ambition is this kind of targets. Our core funding arrives us at 80% of those targets. How about we do a debt swap to help us reach 100% of those targets? So focus on impact. The second thing, as I said, is this shouldn't be project-oriented. Debt swaps take a very long time to negotiate. And sometimes the funding flows are very hard to predict. Something could come in 2 million in year one, 3 million in year two. All this payment schedule is very hard to predict. So if you have underneath it a platform that knows how much funding you need and how much you can achieve, regardless of the funding that is being generated, you have solved the problem of funding flows mismatch. The third thing I would like to highlight is, again, think against the common reactions. Debt swaps take about 1 to 3 years to negotiate. Our average transaction size is about 16 million, very modest. And it takes a very big effort of coordinating donors, creditors, debtors, and implementing platforms. If many of you are discouraged by that, then you have to rethink. Only those people who insist, persist, and do not take no for an answer for the sake of healthy women's, children's, adolescents population will manage to tap into a resource that, yes, it's not huge, but there is impact to be achieved. We have proven so through 14 transactions, 330 million of health investment generated, and close to $500 million of debt canceled through our debt to health programs. So whenever everybody says it's too little, too late, do not take no for an answer. Thank you.
Thank you. Thank you for that, Velasquez. Really point in case, as one would say. Do stay with us. There is a barrage of questions that have come for you. Couple of them are, I think, clarifications. But if I could just have you for a moment before I do go back to a colleague from Ethiopia for their intervention. The first is where to find more information on which country is paying debt to Netherlands. The second question is, what is the impact on recipient countries like CIV on their capital market? And finally, are there any case studies on debt for health swaps outside Global Fund that you can flag for our audience today? And I think there's a follow-up question on in terms of what is cumulatively been the relief that has been achieved by Global Fund since they started using their tool. Can you give us a figure, if possible? Over to you.
Thank you. I will start with the last question, which I just mentioned. Cumulatively, the debt canceled to countries thanks to debt to health transactions to date is close to $500 million. It's about 470 million, and this is slated to become 570 million because we'll have another 100 million of debt swaps coming in our pipeline. Impact on the capital markets. That's a very interesting one. If you noticed in the track record of our of debt to health transactions, one of the most successful user and implementer of debt to health swaps is Indonesia. Since 2007, Indonesia has graduated from a country that was over indebted and in debt distress into a country that now has stellar above investment grade risk ratings in the capital markets, and it is tapping into the capital markets very regularly. So the narrative has changed. Back in 2007, Indonesians were reaching out to creditor countries with a narrative that they were under debt distress and debt swaps could help. Right now, they do not even want this to be seen anywhere, and they are very careful whenever they are doing more, bigger, higher, and highly impactful debt swaps. All the press releases, all the communications do not mention anything about debt distress, about debt relief. In fact, it's debt conversion 1-to-1. Their latest transaction, signed in December 24, had Germany canceled 75 million, and in exchange, Indonesia contributed 75 million, exactly 1-to-1. So it was a debt conversion, not debt relief. Why? Because they want to make sure that credit rating agencies do not misconstrue their participation in debt swaps as a sign of debt distress. which would have a negative impact in the cost of borrowing in the capital markets. The example of Indonesia is really great in showing how a country can still use effectively debt swaps, while at the same time ensuring that not only there is no negative impact in their cost of borrowing in the capital markets, but at the same time, there is a very visible and impactful health impact. Case studies. I would invite everyone to read a very interesting case studies by the Nature Conservancy, which has pioneered a new type of debt swaps, commercial debt swaps. This is for nature conservation. This is not the scope of my presentation because the Global Fund is focusing currently on bilateral debt swaps between a debtor and a creditor, while the Nature Conservancy case studies is about countries refinancing commercial debt with new, cheaper commercial debt and channeling some of the savings into nature conservation. Has created a lot of interest. I think my colleague Adila Babu will talk further about that. This is where I would direct you to. I think I've missed one of your questions, if you can remind me.
Netherlands. Which country is paying debt servicing to Netherlands?
You can find all that in the International Debt Statistics database of the World Bank. It's very comprehensive, and even though it is not complete, it's a very good proxy to give you an idea of what types concessional versus not concessional debt is owed by what creditor to what debtor.
Thank you so much, Velasquez. We'll come back to you later in the conversation for any other questions that might pop up. But if I could go back to you, Guillaume, and it was really extraordinary to hear about Ethiopia's success in the debt for health journey. But if I could ask you a question as a follow-up, what are the biggest missed opportunities in leveraging debt swaps for development outcomes in your reflection? Over to you.
Thank you for that question. I hope you can hear me.
We can. Please go ahead.
Okay. I think my colleague just kind of attuned to what I'm going to say. I think encouraging creditors to go for one-to-one would be one potential area. I think in the case of Ethiopia particularly, I would have liked to see that because what really happens is not just about debt cancellation or debt swapping, it's also about encouraging the governments to invest more in priority sectors like health. So in this case, maybe encouraging, if I cancel $10 million for you, then you have to invest the whole $10 million. In fact, you can also demand for more. If I cancel $10 million, would you like to invest?
Okay, we seem to be having a technical glitch. We will come back to the colleague from Ethiopia once we have the technology resolved. I think there are connectivity issues here. But in the interest of time, and given that we do have a plethora of questions that have come through, and I would really like to hope to be able to cover several of them, let me come to my colleague on my left, who's been listening to this conversation for a while now, Rose Oronje, Deputy Executive Director and Head of Program, African Institute for Development Policy. Thank you really, Rose, for joining us today, and also to give a critical CSO perspective. Rose, how can civil society engagement in debt processes be institutionalized to strengthen accountability?
Thank you so much, Rajat. And this is indeed a very critical conversation. I think I'll just perhaps just remind us very quickly that, like any other development issues, CSOs are central to countries and governments' efforts in the debt management issue, particularly in the debt management issue, given the challenge that this is posing to fiscal space for often neglected development issues. And so beyond just, holding governments to account and monitoring how, debt swaps are being implemented, but also even requiring that those terms under debt swaps are made public is so critical. And often these are often information that is not readily available. We know that in many of our countries, we have very clear legal frameworks for public participation. Kenya is an example. We have a very clear legal framework for public participation, and CSOs are part of the public. They provide a very critical bridge between government and citizens. But often, when you look at examples where what role CSOs are playing, even in Kenyan government's debt swap processes, you realize that even though it's in the law, they're still not central. They're not on the table all the time. Often it's tokenism or ad hoc. And yet the law does provide for CSOs being on the table in terms of our public participation law. And so when I think about institutionalization, it means that we need to do more, go beyond the law. And one of them is ensuring that the agreements countries are signing on debt swaps actually clearly define the commitment that countries need to make commitment within those agreements that CSOs will be on the table. Not just at the end, but on the table in the design, on the table in the implementation, on the table in the audit. And that is important because, yes, we have laws, broader laws, like the public participation laws that are already being ignored. And we've seen in Kenya, for instance, CSOs having to fight for that space, having to fight to be on the table, even though the law is very, very clear. And so one of the things that CSOs could do, I mean, of course, continue what they're doing. Many of them actually quite outspoken in terms of coming to the media and talking about these debt swaps. I'm just talking about the role, the need for citizens and for CSOs to be on the table, to know the terms of negotiations, but also importantly, to even inform some of the programs or the projects. We've seen sometimes debt or loans sometimes being used as political instruments, and CSOs have a role to ensure that debt swaps or funds coming from debt swaps are actually used in a transformative way and not just used as a way that ensures that political leaders are re-elected. And we've seen that happening even in this country where, yes, it's a loan, but somehow the way it's being implemented, it will not be transformative. And so it's the role of CSOs to hold governments to account to ensure that those funds are actually being used in a way that they're transformative and they're not being used in a way that they enable, leaders to be re-elected. Coming back to your questions, I've talked about the agreements countries are signing to ensure that there is a clear role for CSOs, but also for CSOs to take advantage of access to information laws, because sometimes much of this information on debt, especially, is just not readily available. And many of the countries have access to information laws. So how can CSOs draw on those laws to ensure that this information is being made available, is being made accessible to the public? Because these laws are there. A country like Kenya has very clear access to information laws, but the extent to which information like on debt swaps is actually being made available is questionable. I think the other thing would be also for CSOs to also engage perhaps other government bodies. Like for Kenya, we have a very clear role for parliamentary oversight in public financial management. And so our PFM Act is very clear on parliamentary oversight. It doesn't mention CSOs, I don't think it does, but it does mention parliamentary oversight. And so how can CSOs engage the parliament that is clearly defined in the law that has a role to play within debt management? How can CSOs engage them to ensure that the engagement with government, with the executive, is also not necessarily politically driven? Because in some countries, parliaments are already captured by the state. And so what is the role of CSOs to ensure that parliaments also actually play their role, because they are legally recognized in the legal instruments that play their role in holding the executive to account as far as debt swaps are concerned? And so I think I would think that there are already broader legal frameworks in many of our countries, and they need to be used. Somehow they're being ignored because we don't see CSOs on the table or formally on the table, all the time on the table in terms of how governments are negotiating. In Africa, I was actually looking earlier, I think there's just Seychelles that has some clear legal framework around the role of CSOs in debt swaps, specifically for that. And so for other countries that don't have that, they would need to draw on the broader legal provisions for public participation, which includes CSOs. So we need to draw on those laws, but also ensure that as countries sign these agreements, they are actually formally requiring that CSOs are in those agreements that are required to be on the table, to inform the design, ensure that citizens are involved, ensure that priorities for the funds are actually priorities for the communities, and not just priorities that are not aligning with community requirements. But also just ensuring that there are audits as well, even for this debt swap, the process. So the process, they should be on the table all through the process in terms of negotiations in terms of design and implementation, but also in terms of audit. And there's quite a bit, I think the legal framework is there, but there's quite a lot more that can be done for them to be institutionalized. Thanks.
Thank you. Thank you so much for that, Rose. Really powerful stuff. And importantly, emphasizing the need for transparency, public participation, laws and policies that enable that public participation to hold governments to account ultimately for these aspects. Last but certainly not the least, Adil Ababu. Adil, you've been hearing us patiently for a while now, Senior Program Officer, Gates Foundation. So if I could come to you, Adil, from a development partner perspective, what are some of the key enabling conditions that make debt swaps viable and scalable as a financing instrument for health? And then I have a couple of very quick follow-ups to our panelists, and we will be opening the conversation to those in the room and virtually for any final questions that they may have. Adil, over to you.
Wonderful. Good morning, good afternoon, good evening, everyone. Thank you so much for giving me the opportunity to be part of this conversation. Really interesting and good to see some familiar faces. So let me suggest 3 enabling conditions.
Adil, would it be possible for you to speak up a little? We are hearing you very faint in the room, please.
Can you hear me better now?
It is a bit better. Yes, thank you.
Wonderful. So thanks again for the opportunity to be part of this panel and this conversation, which is really needed. So let me start by suggesting 3 conditions that government should look at when they engage on a debt swap. The first one is what I call discipline triage. And by that, I mean that not every country, not every debt stock or health priority are suited to a debt swap. Government should be able to quickly distinguish between commercials, debt swap, bilateral debt swaps that we've discussed, but also the possibility that the swap is not a desirable outcome as well. That way, the scarce technical and political bandwidth is focused where a transaction is genuinely feasible. So a couple of pretty simple rules of thumb. For, say, a commercial debt swaps, the prerequisite is to have large, expensive external commercial debt. And you also need a guarantor to be able to enable that transaction. And what we've seen in the past is the African Development Bank, the World Bank, or the US Development Finance Corporation could be enablers for those kind of commercial debt swaps. For bilateral debt swaps, as Vlasis has mentioned, a government can reach out to their bilateral lenders that are committed to debt swap. So you've seen a lot of mention of Germany in the presentation. We also saw recently Spain and Italy making commitments. So if you are indebted to those, that could be an opportunity there. An interesting development that's recent is China's first ever debt swap, which is currently being implemented in Egypt. And that's obviously a big, large lender to African governments. So the good news, as was mentioned in the chat, is that there is public information to be able to make that triage, at least an initial triage, and that's through the International Debt Statistics database, which I've shared in the chat. The second condition is to identify the health expenditure that are a good fit for a debt swap structure. So Vlasis has mentioned the model which they turn things upside down, they're able to identify based on funded quality demand. Couple of ideas here in terms of identifying the right kind of purposes for a debt for health swap, which are part of a paper that I put out last year. The first principle is to define a long-term vision for the swap. If the money is used over a certain number of time, what can be achieved over 5, 7, 10, even 30 years in the case of some debt swaps, which can be disease elimination or sharp reduction in maternal and child mortality, for instance. The second is to target expenditure that benefit from long-term predictable financing, such as vaccine campaigns or, say, women's health. The third one is to make sure that the funding and the projects are additional to what the government would have been doing otherwise. And to be clear, debt swap resource can be used for any sector. There's no sector that is more preeminent than others, even if I'd like it to be health. And that's where there needs to be advocacy to governments, to engage with governments, outside advocacy, and to make sure government can put health on the map when engaging with their lenders. The third condition, enabling condition, is probably the one that I think that is workable, but a pretty binding one is just to roll up our sleeves and put in the work. I think Vlasis has mentioned that there needs to be work that come into those. It came also across in the Ethiopia example. And this is where the health sector, at least on the commercial debt swap, has been lagging behind compared to the nature conservation, for instance. And there have been no commercial debt swap in health to date. And to be clear, countries such as Gabon, Cote d'Ivoire, and Angola have been able to close those transactions. So this is doable. It's just a matter of putting the right effort. And an important one is coordination. As was mentioned both by Vlasis and Geray, is debt swap move at the speed of coordination. The countries that are the most likely to close debt swap are those that create empowered team between finance and health ministries, and they have the authority to engage advisors, test structures, and make choices and decisions week by week. The good news is that while it seems maybe quite a lot, the governments are not on their own and they can benefit from support. As far as the Gates Foundation is concerned, we've been trying to grow an enabling environment of partners for governments that are really intent to structuring debt for health swaps that are meaningful. That includes one, providing knowledge. There were a lot of questions in the chat, and there needs to be more knowledge around those. What are the trade-offs that are involved? So we have a couple of policy papers that we supported through the Finance Development Lab, some of which I put in the chat. Also, we've been working with the African Legal Support Facility, ALSF, which some of you might be familiar with. It's hosted at the African Development Bank. And the ALSF put out 2 years ago a debt swap guide, practical guide, and last month actually finalized a guidebook on debt for health swaps that are made for practitioners, for health and finance officials. And that guidebook will be shared through a dedicated training workshop in Africa in July. The second one is coordination and structuring. So here we've been working with the SGS advisors as an entity that could provide support to government that are willing to close a commercial debt for health swap. SGS advisor can work both with health and finance ministries to help design a fundable health program and coordinate the various stakeholders to bring a transaction to a close. And they're active now in countries in Africa. The last one is legal and financial advisory. It's an important part as well of this work. And here we'll be supporting the African Legal Support Facility, ALSF, to provide the necessary legal and financial structuring to support debt for health transaction, as well as capacity building, which is needed. Again, there's a lot of capacity gap and knowledge gap, and that sometimes can be done through paper, but sometimes through direct capacity building and outreach. My last point is on scalability. For bilateral debt swaps, I mean, they could scale to some degree, but they're limited by the generosity of donors, and we know this is not necessarily the best moment right now. For commercial debt swap, I will break down scalability into two parts. The first one is within country. To be clear, the first debt swap, as the first of everything that we've never done, is always the most challenging, and that's going to be the case. But what we've observed is that there's a learning curve. And for instance, if you look at countries that have closed a debt swap, they tend to look for another one. So for instance, you look at Ecuador and Barbados, they closed 2 commercial debt swaps, and actually both of them are looking to closing a third debt swap. So the learning curve is a real thing. And I think the first one obviously is harder, but then there are benefits over time. The second one is between country, and here the real scaling challenge is to standardize the process enough so that governments don't have to start and reinvent the wheel and start from scratch every time. I just want to close by saying that I'm hopeful that we'll see the first commercial debt for a swap in Africa over the coming year, and hopefully there'll be an inspiration for other countries to take this on. Thank you.
Thank you so much, Adil. That was very helpful and comprehensive, and really appreciate all that you have laid out for us. Colleagues, we are fast approaching the end of the time that we have with each other, but we still have about roughly 20 minutes or so. And I want to use that to hear from you. And we do have a couple of hands I can already see go up in the room here, and I will come to you in a moment, but it's also Mentimeter time again. And so if there is a question coming up on the screen, if I could please request your indulgence, and if you can please help us capture your perspective on key challenges and opportunities in leveraging debt swaps for health. And while you do that, and we had previously put out that Mentimeter board, and you can see how it has been populated. While colleagues are doing the QR code, let me come to the room and to you, sir. You've been waiting patiently. Over to you.
Thank you very much, moderator. So my name is Christoph Ben. As Vlasis mentioned in this presentation, I originally initiated the debt health mechanism when I was working in the Global Fund, and I implemented many of the debt swap mechanisms that Vlasis had on his screen, together with Vlasis and other members of my team. So thanks, Vlasis, for your excellent presentation. But as of 1st of January this year, Director General Dr. Kaseya of Africa CDC has appointed me as his special advisor on debt swaps, with the mandate to promote the increased use of debt swaps for health here on the continent of Africa. So in that function, I have had many discussions already with ministers of health, ministers of finance at the last AU summit in February in Addis, and also this morning in the main plenary. Some of you might have attended that. There was a lot of discussion on debt swaps and how we can promote that. So just a couple of comments, because I know we are basically at the end of the presentations here. But from my perspective, the main challenge, first of all, is to identify more credit countries that are willing to swap debt. Because otherwise we are talking very theoretically about using debt swaps. Germany has no doubt been a pioneer of this, and it was mentioned as part of their pledge last year to the Global Fund replenishment, 100 million euro additional on the table. It was repeated yesterday and also today on the panel. But there are also other European countries that are using debt swap instruments. Spain has been using the particular debt to health type, which includes a third party, in this case the Global Fund. But other countries like Italy, France also have a significant experience with debt swaps, but they prefer bilateral debt swaps, so they're not involving a third party. Key will be for the next months or a year to see whether we get some Asian countries interested in offering debt swaps as well. That would greatly enhance, the availability of this one. Once you have the creditors, then is the challenge to kind of match the creditor with the debtor country. And this is usually not, like you're not applying, right? When Germany announces 100 million euro, it's not that countries now send their applications to that. Every creditor country has specific criteria, which countries qualify. And out of that list, then you can then start negotiations. And the same would apply to Italy, Spain, others that might be interested. But that doesn't mean that there should be a lot of effort now to also prepare in African countries for that process, because it can be quite complex and it requires some technical expertise. But that's exactly what Africa CDC is intending now to offer. We are there to offer that, so we can work with a number of African countries that are interested in doing that. And then, as was mentioned as well, and Adil is an expert on that, there's not just the kind of public sector debt, but there's commercial debt. There are many different types. They're also different in terms of complexity, and more complexity means more time required to kind of reach an agreement. But the gain is, you also have much bigger debts. For example, the famous one that was mentioned here, debt to nature, Ecuador, that was a debt swap of 1.5 billion. So the different, category, it's a different level, but also took about 5 years to negotiate. So we have to differentiate the instruments. We have to match the creditor-debtor countries that then enter into these negotiations. But as many speakers have said, it's a great instrument because very elegantly it addresses two big challenges at the same time: lowering the debt burden and increasing the fiscal space for domestic investments in health. So that's a whole kind of mandate and issue now. And it's great that we are having this session here, and happy to work with anybody who's interested to pursue it. Thank you.
This is really remarkable in helping to demystify some of those issues. Christoph, I have a quick follow-up which came online. Could you please briefly articulate what's the difference between a debt swap and a debt cancellation?
Right. Debt cancellation means just unconditional write-off of debt. This is usually negotiated in Paris Club and other multilateral instruments, completely different category. As was mentioned here before, debt swaps for health are not meant to address debt distress of countries. The amounts are relatively small, and but it has the advantage that it can go bilaterally relatively fast. Doesn't involve, World Bank or Paris Club or anything like that. Debt cancellation is usually done through multilateral instruments, and it has its absolute place. This is swapping debt that is conditional on the investment then of that amount into health programs, but can be done bilaterally.
I hope that explained it to our colleagues online who were asking for that clarification. There is also a question about how do capital markets react to debt swaps and whether there are trends that we can follow. But let me come to another question from the room. There are two hands that I can see online. I'll come to you first, sir, and then back to you.
Thank you very much. I'm Pascal Wiringabagabo from Rwanda. I'm a health economist and very interesting topic. I just wonder after all this, the presentation, why African country are not seizing this opportunity, because they seem to be low-hanging fruit for everyone in the room, everyone, but it's not always low-hanging fruit, but they may have some and issues around. Because when we are talking about this, one thing's come in my mind. It's all about the farmers' innovative financing of health impact bonds, and how, however, very if I may say simply, everyone could get it, but country resisted. And by that time, I remember I was still in the Ministry of Health, in the health financing unit, when we used to go to the Ministry of Finance for negotiation of health impact bond. The Ministry of Finance was very, very happy of the initiative, but the Ministry of Health was very, very resistant. And after analyzing behind the curtain between technicians, we come across to that aspect that the Ministry of Health is refusing the health bond, because once you get the health bond, the Ministry of Finance will tend to reduce your amount of budget in the public budget, which at the end, the bonds are not sustainable and you are losing your sustainable source of financing. In this case, and I'm very happy in the introduction, you did very well, the quality of data, which without quality of data, we will not have result-based financing. Of where I think is where the debt swap will, because I'm sorry for that. I think it's very tricky. If we can take as a global fund, and then I understand, I'm sorry for collect from global fund here. You are using vertical projects. So saying that the debt swap will be based on projects, then for me, I will be resistant, because while we are saying going horizontal and we're still moving to project, then can discuss. That's something we can discuss. Okay. But I think we can just see why countries are moving away from this, despite since 2027, the opportunities there, I think.
Sure. And I think that's a fair point. If it is a low-hanging fruit, why is not everybody grabbing it? And I think we'll come back for some responses. But I do think colleagues were not saying it is only for project and vertical initiatives. I think there was a detail that might not have gone. But I'll come back to colleagues for quick responses before we conclude the conversation. Go ahead, sir.
Thank you so much. My name is Dr. Edwin Bogo from Catholic Relief Services. Just picking up for my neighbor here, Africa is swimming in debt, and this is one mechanism that we can really use. But our biggest creditors, I think my neighbor has mentioned, is private creditors, multilaterals, and some other bilaterals like China, who may not be actually contributing to this mechanism. What other incentives can we probably, and trade-offs, can we probably think about beyond, the shared need for social impact that is driving the other, debt swap appetite? What other incentives or trade-offs can we think about, or are there for this bigger chunk of creditors. Thank you.
Thank you. Thank you so much. So what I'll do is come back briefly, and maybe, Christoph, if I can indulge you for any quick reflections on those couple of things. And then online, if I could come to, in particular, Velasquez and Adil for any brief reflections to some of these questions that came, and of course, anybody else, my esteemed panelists who would want to share any concluding remarks, and then we will wrap up our conversation today. Christoph, would you like to go first?
Happy to. And maybe take your point. And let's take an example. If Germany offers the Minister of Finance of Rwanda to cancel 50 million euro, the Minister of Finance would say, excellent, let's do that. When Germany says, yes, but this is part of the swap. So the condition is you pay that 50 million into health. The minister would probably first say, oh, I would prefer it, I can use it for whatever the priority of my Minister of Finance is. But that's not a swap. So Germany will say, no, sorry, either you give it to health or it's a no. So, but that's why I hardly know any Minister of Health who doesn't like that instrument very much, because for them, it's usually an additional money in their budget. And for them, it's increased domestic finance. They get more money from their Ministry of Finance, right? So it's very popular usually with Ministers of Health. Ministers of Finance prefer unconditional, but that is then not a swap, that's a cancellation, right? And that's a different story. There might be a place for that, but that's the difference. It might illustrate that a little bit. And yes, commercial debt is the commercial debt of many countries much higher than the kind of bilateral sovereign debt, and can be addressed, but it's more complex. It includes much more partners. You need to use guarantee instruments and many others. So we don't want to exclude any opportunity, any option here, but they have all different advantages and disadvantages.
Thank you. Thank you so much for sharing those reflections, and maybe you can take any further clarifications offline as well. Adil, can I come to you next if you are with us still online?
Yes, absolutely. No, these are great questions. Let me try to chime in to complement. What I agree with Chris is that it's you have there are two different players that are the finance and health ministries, and they have different incentives. That's why the results ends up being the subject of a negotiation. So if you look at the Global Fund track record, there's been a part that was cancellation, which essentially translates into fiscal space for whatever the Ministry of Finance wants to do, and a part that goes into the Ministry of Health. If you look at the commercial debt swap, very often they've been structured around one share that goes into some form of debt cancellation, and the other part that goes into projects. So I think it's all a subject. I think there's a way, when there's enough fiscal space generated, there's a way to generate a good discussion and for both parties to have a say. One of the principles I've highlighted in the paper I've shared above is to make sure that funding is additional. And maybe Vlasis could say a few words about the unmet quality demand, which is really guarantees that additionality. There are different ways to think about additionality, but I think even from a donor standpoint, when there is a donor on the other side, I think they're much more at ease when there is additional impact that can be brought in. So I think that's one way to work with the donor, but also with the credit enhancer. If you work on a commercial debt swap, the guarantor also wants to see additional things that the government would have been to achieve. And I think one of the beauty of those mechanisms is that sometimes the funding is released over a long period of time. So it's way above the budget cycle, which is 1 year, as everyone knows. So that gives a predictability that the Ministry of Health would necessarily have, and the ability to engage on a longer term. So briefly as well, on the private credit, there's been a trend that started in 2021. That's what I qualified commercial debt swaps, which are by design more scalable because they're much more private creditors than bilateral creditors in terms of lending, and they've been applied both to bond and bank debt. So, for example, the World Bank worked in Côte d'Ivoire to refinance commercial debt. We've seen bonds in the case of Ecuador and so on. So these can be used. And again, as I mentioned, I think it's an interesting development is that China has done their first debt swap in Egypt. They're currently implementing it, and maybe that will open the way for more. So I think there's the landscape of debt is changing. So should the landscape of debt swap also adapt to how the landscape of debt open.
Thank you. Thank you so much, Adil. Very helpful. Vilasis, for any last words.
Very quickly, just to complement already very good interventions and responses by my colleagues. The Global Fund and other platforms should think about replicating this. What it does very well is pictures and costs national health funding strategies of countries. They are country-led, and it builds on funding those from the core up. It costs what parts of those national health funding strategies are unfunded for the time being, but still approved for their technical orientation, and then proposes it to donors. Whether these are donors from foundations or donors or bilateral donors who want to give additional funding to the Global Fund through debt swaps, it is one and the same. So we use it as part of a gamut of innovative financing instruments in order to fund specific programs. So one additional incentive for creditors that was asked in a question is the visibility of a creditor that A, does something to address, even a small step to address global over-indebtedness, but at the same time targets funding towards specific programs, towards a country of interest, towards a program of interest, is a very important incentive. Finally, for additionality, we have an entire health financing team at the Global Fund that counts exactly that debt swap resources generated from these transactions are additional. They do not displace, they do not replace, but they come as complementary to current funding. And this is a fundamental cornerstone of our model. I'll stop there. Thank you.
Thank you so much for that, Vilasis. And I think the signal is being given to us that we need to stop as well because the electricity is off in the room. But having said that, and without wanting to sound any bit more facetious, what a remarkable conversation. Thank you so much to all of you for joining us today. I think the conversation has demonstrated itself. We are at a turning point. We are at a turning point, and as the discussion highlighted, what lies ahead requires political will, requires intentionality, requires a clear pathway for us to move these ideas on innovative financing from concept to actual action. My sincere thanks to the Global Leaders Network for bringing us together, to Dr. Lawasi Manzi, Head of Secretariat for the network, for helping us convene this conversation and to bring all the speakers and facilitators together and all the partners who joined us and sponsored this event today. Thank you so much, colleague. We will have the recording of this session available online on the Global Leaders Network platform and also other materials that you may find useful. Do join us for the next episode of these conversations as we move ahead. Thank you so much and have a lovely rest of the evening.
Thank you.
Thank you.